We're in sunny Leeds at Meliora Dental, and I'm joined by Kunal Rai, owner, CEO, principal dentist here. A bit of everything.
Yes.
He's got a lot going on, and I'll leave him to introduce himself to everyone.
Hi guys, I'm Dr. Kunal Rai, Principal Owner, Clinical Director for Meliora Dental. I'm based in Leeds. I won't say it's sunny today, it's a bit it's on the cloudy version, it's a bit cold, but yeah, we're here today. I'm looking forward to this interview.
Grand, amazing. So can you tell me a little bit about how you got here? How did we get to Meliora Dental?
So I graduated in the year 2015 from Charles University in Prague. I did it was MDDR, which is a Master in Dental Medicine. I initially did a BSc in Computer Science with Artificial Intelligence. I was doing my internship and I absolutely hated it. I was like sitting in front of a computer just typing away, absolutely hated it. But luckily, because I come from a medical family background, I did my A-levels for dentistry and I also did my training. But the Silicon Valley boom happened and I was like, why should I spend 5 years studying and then more years when I can earn the same amount of money doing a 3-year course? But as I said, I did my internship, I absolutely hated it, and that's when I realized, okay, I'm going to go back and do what I really initially wanted to do. And I went back to studying dentistry in Charles University in Prague, qualified in 2015. Then I did my VT for Oasis, which was owned by Bupa in Bridlington. And then for 8 years, I was in Bupa Pontefract, working in a mixed practice. So that was initially just pure NHS, and lucky enough, I became a lead clinician doing 50-50 split there. But somewhere in my subconscious, I always knew that I want to have my own place and I want to have somewhere closer by so it's easy accessible for myself. So I can come whenever I want to the practice and do what I need to do at the practice without thinking about the distance. So in 2023, I started looking into different websites and I came across Meliora Dental, which was up for sale. I put an offer. I knew where the practice was located because my grandma used to come here for her dental checkups. At that time, it was only on the top floor where we are now. So it was 100% National Health. I placed an offer, got accepted, and in February 2023 is when we moved in here.
Wow, amazing. You touched on it there. You said when you inherited this practice, it was 100% National Health. But now, obviously, as we said when we introduced you, you're in a mixed model practice.
Correct.
What was that sort of like defining moment that made you go, NHS only isn't the way to be here?
So like I mentioned, in my subconscious, when I was working in Pontefract, I knew that 100% National Health is not the way forward for me. I have invested a lot of money myself doing masters in masters in dental implantology, a PG diploma in restorative, PG diploma in clear aligner therapy. Now, these kind of things that I have done a post-graduation degree in, I cannot give under the National Health because of the financial restriction and the model, the way it works. And when I walked in here as a practice owner, I saw a different picture. When you're working as an associate, you just worry about yourself. You worry about how you're treating with the patients. But when you come to as a practice owner, you're thinking about the whole business. The first month itself, when I looked at my monthly statement and I realized with the amount of money that is coming in and the amount of work that I need to give to these patients, because it's a high need area where this practice is based. Patients are not coming in just with one filling. They're coming with 6, 7, 8 fillings. The only thing I could do was do the bread and butter. Put some silver filling in, see you later, or do an extraction, give them a plastic tooth. But there were other things I could offer them, like implants, teeth alignment. These things they couldn't be provided in the National Health. So that moment of time, I thought, okay, if I don't want to undervalue myself and I want to make use of these degrees, of these extra courses I've done, I need to change something. And that's when I thought, okay, we have to move away from just doing pure NHS. And that's when I dropped my UDA contract we still have an NHS contract, don't get me wrong, but I've halved it.
Yeah. So it was you realised that you just couldn't give the level of care that you wanted.
Yeah. With the finance that coming through, I could not. It's not just about being greedy about the money, it's about your staff too.
Viable.
Yeah, it's not viable. Staff, everyone works for money. Everyone wants a pay rise. We as a dentist I was on X amount of UDA per UDA since 2015, and I was all the way at Bupa for the same amount. But everything else is going up. at that time, I didn't realize how much all the equipment that we buy costs, but we're paying VAT on top of that. These things, we can't add VAT to our medical treatment because it's for medical reason. Everything started adding up. And if you want to retain staff, you need to give them a decent amount of money. And we couldn't do that on the NHS.
Yeah, for sure. Yeah. And you know, you talked about how it affects your level of care, but it's still quite a big decision. Like going from that 100% model to even 50% is quite a large decision. And so I'm guessing there were challenges. I'm guessing it was a bit difficult at the time.
It was tough. It was tough for me. It was more tough. It was tougher for the practice manager as well as reception. Because the way we thought, okay, now for sustainability, we have to drop. And when we dropped our UDA we had a 21,000 UDA, now we're on 13,000 UDA. So we had to decide which patient we're going to keep, which patients we're not. It's not about, okay, we're going to take this all away. We started looking into the flow, how are patients coming in. Patients that are regular coming in, we'll honour them, we'll keep them under national health. Patients that are just coming in as of when they want, when they're in pain. Okay, there's a pattern here. You're neglecting your teeth. You're only using this as a drop-in centre. We're not a drop-in centre. We are here to help you. So we thought, okay, you haven't been in for 6 months, 12 months. After the 12 months is the cut-off period. If you haven't been here for 12 months, we're not going to keep you on the NHS. So a patient came in, for argument's sake, for pain, and he wanted to make an appointment, but the receptionist said to him, oh, sorry, you're no longer on the NHS. He got agitated. I'm entitled to this. I need it. You have to give it to me. And the reception explained to him, you haven't been here for 3 years. You're here today just for pain. Where were you all this time? There was a bit of a argument going on, and that person spat on our receptionist, swearing at her, which was like, these are the things challenges that we had to face. And then people leaving bad reviews, it started affecting us. When I moved from Pontefract, we brought a lot of patients from there. It's like that goodwill feature of dog, rats and cats. Dogs are always loyal to you, and I had loads of patients coming from there, and they were happy to move on a private because they know that the treatment they're going to get, the quality they're going to get is beyond and above what they can get under the national health.
Yeah, and I think that you kind of touched on it there. It's about getting people to realise and sort of invest in their own oral hygiene. And I think that's something that sometimes when you know that you're on this long NHS contract, you're like, I can go in 3 years' time and it will still be there, and sort of putting the onus back on the patient a little bit, and you know, still giving them affordable care, but saying it's no longer going to be on an NHS is difficult, but I think long term good for the patient.
Absolutely.
So then a lot more change for you. So you did that, which is you know, quite incredible in itself, and then you thought, you know what, it's time for me to invest in some new tech. You know, now I've got this money, I'm not just going to take it in, I'm actually going to reinvest it in the practice. And that's where we saw things like AI coming in. So how did life change for you in that period of time when you started on taking that new tech?
So moving on from a pro NHS to a mixed model, I started seeing income, and with the income, it was not just about putting the money in my own pocket, it was about making the practice more efficient, bring away precision and efficiency to the practice. So I started investing in software such as, I got Kiroku for myself for note taking. I've got Pearl, I invested in an iTero scanner. The reason behind it is that I could then spend more time with my patients. So instead of standing behind them writing notes with the Kiroku, I am now actually sitting with the patient with my mic on, so notes are getting written straight away. So it's about building the rapport. By building a rapport, patient starts trusting in you, and if you listen to them, you build that empathy relationship. You no longer, it's a transactional value treatment here, it's more about long-term relation. And then I invested in Pearl. The advantage of using Pearl is that it's no longer a conversation of, trust me, I'm the dentist, listen to me. It's more about, it's there for you. You can see it for yourself. Because as we know, a picture is worth 1,000 words. We as human, and I certainly believe, I believe in what I see rather than what I hear. And like with Pearl, it's visually annotated. You can see what's happening with your teeth, and it just empowers the patient to make the right decision. And for us as dentists, it also helps me, especially if I come back from lunch, I'm a bit tired, and I'm spending damn, is there caries, is there not caries? So instead of spending that time there, I can just focus on, it's already been pre-screened, these are the cavities there, and I can just have that conversation with the patient. So it really, really helped me. Even we've installed Boxley for automation, it making not just us dentists' life easier, but also for reception. It's making them easier. They're spending more time as a concierge rather than just sticking on the phone.
Yeah, absolutely. I think like when you touch on Pearl and the visual elements, I think like we can't underestimate the power of color.
No.
You know, even down to the practice itself. You put some bright colors in there, people are welcomed in.
Yes.
If they're looking at a greyish blob on their X-ray, they're not confident. But as soon as you see the pink of the carie on there, bam, it's very obvious. So I do agree.
So going back to that, what you just mentioned, so I had just before we installed Pearl and in this practice itself, I saw a patient over lunch. We basically had a conversation. I took an X-ray for him and said, you need X, Y, and Z fillings. This was before Pearl on a black and white image. Most likely, even if I was looking at an X-ray and I was not a dentist, I'll be like, yeah, whatever, and just go and book itself. He went downstairs to reception, said, I'll just pay for my examination. I'll call you back later to book in for my fillings. Then 2 days later, he left a review on our Google. Just went for a casual checkup. It was due. I saw a new dentist. He took some X-rays. I had no pain whatsoever. He said, I need 3 fillings. Stay away from this practice. They are robbing bastards. So it's like, because for them, they can't see anything on an X-ray.
Yeah.
Whereas we can see, we can tell them. But if afterwards I install Pearl, I've never had this problem now. For the last 1.5 years, I've had Pearl. I don't have this problem because now the patient can actually see.
So it's quite obvious to you now that patient confidence is much higher.
Absolutely.
Yeah.
Absolutely.
Amazing. And when we talk about the patients, like you've got quite a high patient volume here, and maybe you can touch on that. But you also there's long hours going on. You said it yourself. You get diagnostically fatigued. Yes. I guess is the right way. Do you really feel the level of strain go down now that you've got something like AI?
Absolutely. For me, AI is a complete game changer. Even little things, administration, and spending less time on admin work, more on clinical work. With Kuroku, I am now, like when a patient comes in, I'm spending more time discussing things with them, trying to get a complete idea of what the patient is here for, not just talking about being reactive, providing a reactive model treatment here of taking them out of pain, but actually being proactive, helping them to understand, or helping them to understand the patient themselves. Why is the patient here? Why has this problem occurred? What can we do for him? So we are able to spend more time, give them more time of our time, and that's what patients like. It's not about treating. Anyone can treat. As a dentist, you can treat, but can you build a rapport with them? Can you make the patient feel wanted? And that's what AI helps us to do, because now I'm sitting in front of them. I'm allowing them to talk to me. My notes are getting listened to with my mic. It's getting written over on the computer. In the background, my nurse, instead of typing, she's getting things ready. If the patient needs something, she's getting everything ready. So makes it more efficient. Yeah,
for sure. And you kind of touched on it there, that these things kind of pay for themselves. Like, yes, they might have a high upfront cost, but when your recalls are getting loads better, patients are rebooking, they're going for higher value treatments.
Absolutely. Just so if we take Pearl as an example, Pearl costs somewhere between £200 to £300 a month. And at the start, it felt like that's a lot of money. But then what I found is, because now I'm having this discussion, I'm spending more time with the patient has started to trust me. And I can see on a screen, because the radiograph has already been pre-screened, I can see AI has identified something for me. Those subtle changes, I can then show that to the patient, discuss it with them. Look, you can see there's a problem there. And I can compare x-rays. This was your x-ray 12 months ago. This is your x-ray today. You can see there's a change. How do you feel about it? So because now patients can see it, they believe in there, and they're taking up treatment. So, and luckily enough, with Pearl, they've got this new feature of where you can compare. You can do a percentage comparison. So that has also helped me. Where I was just providing, with the NHS patient, where I was providing a silver filling, I can just hover over and say, this is going to be like, Otis, a patient came to see me and we just had a conversation, just generally came for a checkup. He has 3 cavities. We discussed, okay, these cavities are going to be X percentage, Y percentage. He turned around and said, Kunal, I don't want to have a silver filling here. You've shown me it's a massive filling. I'm a client-facing person. I'll be doing a lot of talking, and in my subconscious somewhere, I'll be thinking, people on the other side will be like, oh, he's got a lot of silver going on in his mouth.
Yeah.
So can I have a white filling? So these conversations actually helps to sell things without really being a salesperson. So we dentists are there to help. We don't want to be, as a business, you want to sell things, but you don't want to be too salesy, if that makes sense. And little things like this AI tool helps us to sell without selling.
Yeah, for sure. And I'm looking at the numbers here in front of me. After implementing stuff like AI, nearly half of your patients, I think it's around 48%, suddenly were taking up treatments where before they weren't.
And yeah, so it's not just myself. When I inherited this place, there were dentists that were just doing NHS and they were happy to do NHS work only. I've made them now use this tool and they are seeing a difference. They are going happier by the end of the day, because they're not working on a conveyor belt, seeing 30, 40 patients a day, but they are seeing a smaller number, but quality treatments.
Yeah, for sure. And the other number, which is amazing after seeing this, is you've seen a 75% increase in premium treatment upgrades. And you kind of touched on that, going from the silver to the white. But are there other kind of treatments that have got this?
So
like
as an example, last week I saw a patient who came in who didn't registered here as an NHS, hasn't been for 2-3 years. So as I mentioned, through our protocol, she was converted into a private patient. She walked in a bit agitated, or why it is, but in the end, she was quite happy. She goes, actually, I'm quite happy to be a private patient. I'll continue doing it because you gave me that time. Normally in NHS, I would have been here, sat on the chair, 10 minutes later, you would have told me X, Y, and Z, go. But you spent 45 minutes, you actually listened to me. And then you went through explaining everything, and I feel more confident in what you've offered. She came in with pain. We did some x-ray, we showed her the x-ray, and then we gave her all the treatment option, explained it into like, broke it down for her, spent a lot of time explaining why she needs to not just go for a re-root canal. We have a specialist in the practice. She had a conversation with her, said that because of the bone loss, you're better off having an implant on this tooth. So we managed to offer, just by showing her the x-ray, how big the cavity, how big the infection was, she signed up for an implant. She went up from a basic NHS, walking as an NHS patient, she walked out with an implant placement discussion.
And that's amazing. And do you see that in general, like your patient relationships have been uplifted by moving them from NHS to private?
Yes, and main thing is, it's about that journey. We can, like I mentioned at the start, we can all provide a treatment, but it's that journey. If we make that patient feel wanted, it goes a long distance.
Yeah, definitely. So, other tech that you've sort of invested in, CBCT scanners. You're now investing in alignment, which is really, really cool to see. There's so much advanced tech in this practice, like I can't really list them all. How do you see technology like this shaping the future? Do you think there's more to come? Is there exciting things you're
Absolutely.
looking for?
Technology is the way it's going, is driving dentistry these days. Dentistry in the past, definitely, as I will say slightly still at the moment, is more on a reactive model where we're just treating the problem. But we need to move on from that. We need to be proactive. We need to provide dentistry that is based on precision, prevention and efficiency. And this can come from the use of AI. How? By use of Kuroku, digital TCO, spending more time communicating with the patient, understanding them, they understanding you, using Pearl, I'm not just saying Pearl, there could be other radiographic tools out there that can help you. It's about making the patient understand what is happening, and by you and making the patient understand what is happening, they are more likely to take up that treatment because they will start feeling confident in you as a dentist. And if they can see that confidence in your eye, they are more likely to take up that treatment. Again, a black and white image and a color image. A picture is worth 1,000 words. Again, as human, we believe in what we see rather than what we hear. And a picture, if you have visual annotation, they are more likely to understand what is happening, and you're just not selling a treatment to them, but you're also empowering them to make the right decision. You are helping them to understand why a problem has occurred, and what they can do in the future to prevent this from happening.
Yeah, for definite. And with all that in mind, if you were to summarize it into sort of one piece of advice, because there are still skeptics out there for definite, we see a lot of practices that aren't fully invested in this technological journey. What would be the one piece of advice to get somebody over that hurdle?
Skepticism is understandable. We all are going to be skeptical about something here and there. What we need to understand is AI is a tool out there to make us a better clinician. When digital x-rays came out, it never took away radiologists. We still need radiologists for it. If another example is, if we look into medicine, I believe it was in Scotland, they were doing breast cancer screening, and they found out they were able to screen breast cancer at a very, very early stage. So where patients were going through surgery, they can just go through laser, a little treatment, day treatment, and was treating them. So why can we not invest it into dentistry? With AI tools, we can identify things at a very, very early stage. So instead of patients having invasive treatments, they can go for minimal invasive treatments. It can make life much, much easier for the patient. With AI, it can also help us to identify things properly. So we live in a world of litigation where we all are practicing a bit defensively these days, thinking about the GDC, thinking about the no win, no fee solicitors. Always in our subconscious somewhere we're thinking about it, so we're not able to express ourselves. But having an AI tool can make us better clinicians, because we are now able to identify things at a very early stage. We can give the onus to the patient. This is a problem. This is here for you. Would you want us to treat this or not? If for argument's sake you want to postpone it, we can always do a comparison. We can show you this is where you're today, this is where you are going in the last 12 months. And you're documenting it. So you've got something to back yourself up. Same time for the patient, you are not just providing them the best treatment, you're not just telling them what is happening, but you're also empowering them to make that decision. Like, okay, you've got a cavity between two teeth. Why did that occur? Because of lack of flossing, things like that. They're understanding much better. And by trusting you, they are more likely to take that treatment, and they're more likely to come back to you.
Yeah, definitely. And on the line of advice, we talked about the technological advice, but let's go back to the beginning, the NHS advice. What would you say to someone who's on the fence? They're about to go private, they're about to go stay with NHS, they don't really know which way they're going to go. What advice would you give to someone for moving to that mixed model?
I would say is, instead of thinking about treatment, think about delivering a value. Okay. For me, my parents have always told me that, because my dad's a doctor, retired doctor, we have always been brought up with the sense that think about a patient when they come in. This is the only patient you're going to see on the day. Give them the best you can. Make them feel wanted. Don't talk over them. Listen to them. Absorb everything they're saying. Let them speak their mind. By speaking that, it relieves a lot of stress from them. They will appreciate you. So just focus on them. Another example is I have a 7-year-old daughter. We went to India 3 years ago, her first trip to India, and she didn't like the food that was there. So what the restaurant did is they took her into the kitchen and they go, "You guys eat. We'll make her what she likes." And it still is in her mind, in her subconscious somewhere. It's about that journey. It's not, she didn't like, it was not because of the hotel was fancy or the place was good. It was about that journey, that experience. It's all about giving that patient experience. When you move to private, if you do not provide that experience to the patient, where they feel wanted, where you're giving them quality treatment, they're never going to come back. So for me, it's not about, or to an dentist, it's not about modernizing a practice. It's about how well you look after that patient. If you cannot look after that patient, it doesn't matter how good your treatment is, or how many degrees you got, or what masters or what diploma you got. If you cannot provide that journey as a team, then that's a waste.
Yeah, absolutely. I think that's a really lovely sentiment to end on. It's not just about putting money in your pocket. We've already said this, but it's about giving something back to the patient, and no more just metal fillings. Actually, like you said, what are they going to want to see when they look in the mirror? I think that's really lovely. Before we wrap up the fireside chat, if you will,
Yes.
we are by a fireside. Do you have anything else you just like to say about your practice? You know, anything you'd like to announce, or anything like that? Any message, plea to the dental industry, perhaps?
Embrace into AI. AI is there to help us. AI is there to make us a better clinician. If we hide away, because nowadays when patients go, they are social media savvy. They are aware what's happening, what is out there. You could be a brilliant technician, you could be a brilliant dentist with the amazing work, but when a patient walks in and they don't see you using the current technology, they won't come back to you. And no matter how much you advertise over social media, the word of mouth is still pivotal. The word of mouth still counts. A patient can bring in one or two patients, they may be big quality patients, treatment, but they can also take away a massive chunk of your patients away. So do invest in technology. Technology is about placing a layer of precision and efficiency. It can make you a much, much better practitioner.
Amazing. Thank you very much. Thank you, Kunal, for your time. This has been really, really good. Thanks everyone for watching. I'll leave you with a question, just like last time. So one, I'll give you two questions, in fact. One, what would be the biggest bit of technology that you would want to invest in the next year? And two, what are your thoughts on moving to a mixed model practice? Thank you very much for watching, and we'll see you on the next one.